Hi guys, so in today's lecture we will talk about HIV and AIDS. This is a very sensitive topic. This is a very important topic not only in context to your exams, not only in context to management of HIV patients, but also in context to awareness of the particular disease. And before starting this lecture, I would like to request you guys to have empathy for these HIV positive patients and at the same time also ensure that these patients do not face discrimination because it is not transmitted by handshake, hugging, or even kissing. So let's start the lecture. Here you can appreciate various modes of HIV transmission. But before discussing various modes of HIV transmission, you guys must also understand what are not the modes of transmission. Here you can appreciate touching HIV patient is safe. That is, you can do handshake, you can do hugging. Here you can appreciate sharing utensils is also safe because the virus is in very small quantity in saliva. Therefore, even kissing is safe. This is not transmitted by insect bites, particularly mosquito bite. Therefore, these guys, that is HIV positive guys, should not face any type of discrimination. Okay. What are the various modes? Most important mode is your unprotected sex. Okay, not using the barrier methods. And then you have drug addicts, that is IV drug abusers. Okay, for example, intake of cocaine, blood transfusion, be it in any form, that is PRBC, FFP, or even platelet. And here you can appreciate pregnancy, that is mother to child transmission, better known as parent to child transmission. And then there can be accidental needle prick injury, or there can be use of non-sterile instruments during surgery leading to contamination with HIV virus. Okay, so these are various modes of HIV transmission, whereas these are not modes of HIV transmission. As a medico, you guys should know this. Okay, now try to understand. Sexual transmission is most common mode of transmission of HIV. Now try to understand. Nowadays, due to human rights, you can find many homosexuals around, particularly male having sex with male, that is gay. Male having sex with male, right? That is gay. So these carry maximum risk of what? HIV transmission, particularly the receptive partner, particularly the passive partner. Okay, you represent male like this, you represent female like this. Okay, now let's try to understand. Maximum chances of transmission is when male has sex with male. Okay, now here you can appreciate that guys getting tattoo. Okay, so there can be miscellaneous method for HIV transmission as well. Nowadays you can get piercing of any part of your body. Similarly, nowadays you can also get tattoo over any part of your body, and if this syringe is contaminated with someone's blood, it can result into transmission of HIV as well. Okay,